We've heard that an apple a day keeps the doctor away, but public health education can address community health disparities. Hi, everyone. Welcome to Teen Talk. I'm Harini, and today we're talking about our project, Symptoms to Stories. The group with me will be talking about their efforts to improve health literacy in Tulsa, Oklahoma by bridging the disconnect between confusing technical health information and the accessibility of resources to youth. So, today, let's start with introductions. Tell us a little bit about yourself and the public health issues that you're passionate about.
Hi, I'm Nyla and I go to Jinx High School and I run the reproductive health branch.
Hi, I'm Arin. I'm also a sophomore at Jinx High School, and my respective niche in the project is mental health.
I'm Harini, and I focus specifically on youth substance use prevention education and the impacts of the opioid crisis.
Hi, I'm Kaytlin. I'm a senior at Jinx High School and I focus on medical translation.
Hi, I'm Hannah. I'm a freshman at Jinx High School and I'm focusing on helping homelessness get access to public health.
So, Arin, why is youth engagement in public health important?
Well, I think that youth engagement in public health is really crucial because youth is the real age group that is impacted the most by healthcare policy. However, they're also the ones that are excluded the most due to their age and really lack of knowledge that has been built up. But through youth advocacy, it's important because they're the ones that are kind of the leaders of tomorrow, helping bridge these healthcare disparities and these gaps. And if they're able to talk about it more, they can drive social change within their communities.
Yeah, absolutely. I completely agree with that. I feel like there's a lot of stereotypes about young people today, and I think there's a lot of issues that we care about, and public health happens to be one of them, especially because we are so impacted by a lot of these policies, and we may not always get a seat at the table to voice our opinions.
Well, you make a really good point over things that we're passionate about. So can I ask you what made you want to choose the opioid crisis in specifics?
Yeah, absolutely. So I've seen growing up in a lot of the youth substance use prevention education curriculum that's presented to us, a lot of it focuses on fear based tactics surrounding drug use, and it doesn't always reflect fact based education that is more effective and targeted towards youth. It feels like so much of this programming is written for adults by adults rather than focused on teenagers specifically. So I hope to improve authentic engagement in youth prevention education. So, Hannah, what made you interested in the intersection between homelessness and access to healthcare?
When I was younger, me and my dad, we used to go downtown to feed the homeless, and I started developing a passion for helping others. And I feel like homeless people, there's a very big stereotype for them to where people always say they want to help, but they won't actually do anything to help. So I think it's really good we give homeless people access to good, free public health care so that they can have the resources they need.
Arin, is there something that made you really interested in youth mental health?
Yeah, so actually outside of this project, my real first exposure to mental health occurred in middle school. So I was part of the Where Everyone Belongs or WEB program at my middle school, which was basically where I would lead and tour new students who were unaware of what the middle school was like. And actually one of the kids in one of the classes that I was leading kind of really seemed out of it, seemed really isolated and distant from everyone else. And actually when I came back the next day to introduce another topic, he actually wasn't there at class, and I was told that he had to leave the school for self-harm. And this really sparked a change in me, one, because I was really unaware of the impact that mental health was, let alone how serious it could be. And I just feel like this incident really let me believe that mental health is a true problem in our world. And whenever you were able, Harini, to be able to introduce us to symptoms and stories, I was like, mental health is a great facet of public health that needs more attention. I was like, yeah, I'd love to be part of this program.
Absolutely. Kaytlin?
Yeah, so my passion started at my church. I go to a Chinese church, so most of the elders in my church are more fluent in Chinese than English. So when they would go to their doctor's appointments or to the hospital, they weren't able to completely understand the information they were being told by their healthcare providers. And this created a barrier between them and their providers, and also caused a lot of confusion and frustration within them. And most times, since they had no one else to go to, they would have to go to members of my church to help translate their diagnosis or something that the doctor would tell them, which obviously people at church are not qualified to give healthcare information. And I was able to actually see the barrier that language creates between a healthcare provider and a patient. And so whenever you asked me to join the project, I knew this was the niche I wanted to focus on.
And then finally, Nyla.
Yeah, so actually, even before Symptoms to Stories, I was a part of Amplify Youth Council, which is basically just an organization where we raise awareness and educate the public over reproductive health topics, such as like sexual awareness, assault, as well as just different forms of contraceptives. But also, I interviewed just a couple of peers at my schools and found that many didn't have access to period products and menstrual products. And so I felt like there was a really big disconnect and a disparity between our community. And again, when I found out about what Harini was creating, I was like, I really need to prioritize this, especially because it's what I'm so passionate about.
Yeah, that's really wonderful to hear. So, Kaytlin, what makes health related information so hard to understand in this day and age?
So I kind of brought this up with my example with my church, but a lot of information we receive from healthcare providers is very complicated. We didn't get medical education, so we don't really know exactly what they're talking about. They can try and simplify it down, but sometimes it's hard to understand even for someone fluent English. So adding another language barrier on top of that makes it even more complicated to understand. And whenever information you aren't able to understand that type of information, that's where confusion and frustration happens, and that's when the barrier is formed.
Yeah, absolutely. And within my niche of trying to combat the opioid crisis, one aspect that a lot of people don't actually think about often is the importance of safe medication disposal. A lot of people hold on to old and expired medications in their medication cabinets, and having that around can pose a danger, especially for elderly people who may not remember medication expiration dates, access to that medication for pets and children. So, knowing this information about when your medication expires, the disposal instructions, because it's not always safe to just flush some of these medications down the drain. This can pose a lot of environmental hazards and risks. So there's a big gap in providing education surrounding how you can safely dispose of many of these medications, and there's a big effort now to connect people with drug take back days, which I believe the local health department does about twice a year, where you can simply bring all of your old and expired medications and they will dispose of it accordingly in a safe and environmentally friendly manner.
Yeah, I also think adding on to what Kaytlin said, she really focused a lot on medical translation. However, I kind of move past that and just look at it blanketly, kind of looking at emergency medicine and looking at health related information, how there's kind of a barrier. We have to understand that emergency medicine is life or death, and if people aren't able to understand the information that they're receiving, that could cause really serious consequences as a byproduct.
Yeah, that's a really good point. And I just want to make it aware that we're not just saying this, but there have actually been stories
Exactly.
of just people not being able to understand. Like Kaytlin and I interviewed a medical translator at St. Francis who gave a life story and experience of how her friend was unfortunately diagnosed with breast cancer, and she couldn't understand medical jargon because her first language wasn't English and was actually Spanish. And so Maricela would accompany her to appointments and would translate it to make it a more simpler, easier thing to understand. Kaytlin, if you want to add on, just.
Yeah, and that's kind of where her passion for medical translation started, is seeing her friend go through this. And she would be able to accompany her friend to visits and translate or simplify what the doctor was trying to say to her. And it kind of decreased the confusion that her friend was having. And it also made her friend feel more comfortable at the setting of a hospital, which normally or can commonly induce a lot of anxiety as well.
Another good thing is some homeless people, like, don't have like a high education, so they might not be able to understand the information given to them. So I think it's really important that like we can maybe simpler it down a little bit so they can all understand it.
Absolutely. So Hannah, what does effective health advocacy look like?
I think it's where you reach out to small communities or people that maybe their voices can't be heard. So you're making sure the ones that are like neglected or ignored all have a chance to voice their opinions and advocate for themselves.
Yeah, and also the next steps for our organization as a whole. For our website, we are planning on translating the entire web page into different languages, specifically Spanish, Chinese, and Zomi, as those are the 3 most prominent languages we've seen in the Tulsa community, in order to help decrease that gap in understanding.
Adding on to what Hannah said, I think like expanding on some of those disconnects, looking at like the divide between rural and urban kind of healthcare facilities. Obviously, the saturation of healthcare facilities in urban settings is more large than the ones in rural settings. So being able to kind of analyze that disconnect and being able to provide resources to these rural people that need it, or even the urban people that need it but aren't able to access it, is really important.
Absolutely. And Nyla, what does effective health advocacy look like?
Yeah, just like what Hannah said, it's just like touching upon and having a diverse scope with different race, socioeconomic statuses, and genders, making it so everyone can understand kind of what we're summarizing before.
For me personally, I feel like this looks like taking into account like what each community needs, and even the same issue, different people may experience it in different ways. For example, medical translation, like it may look a lot different in certain communities that have, they may experience a lot of mistrust in the medical system because they might feel like their concerns have not been heard in the past, and this can lead to a lot of negative outcomes as well.
Adding on to that, I just wanted to provide like a story, especially with like the recent things in like political scope of the world. There was actually like a National Guard shooting like by a person named Ramanula Lockenwall, and he actually had applied for a mental asylum after he was vetted into the United States from Operation Allies during President Biden's presidency. He actually had like an operation that brought back refugees from Afghanistan, and actually he wasn't able to connect with asylum resources. And this kind of goes back to effective health advocacy, specifically within the mental health niche, which I'm talking about. I mean, there's real world stories that have led to real world fatalities because of this disconnect, because people aren't able to access these mental health resources. There are actually disastrous effects as a result.
And just to like touch up on that, especially in the reproductive health field, I feel like that like especially just like sex education in a whole is not provided to all schools equally or the same. For example, in a more rural area, there is a disconnect as not many people are receiving the right education, but also a thorough, excuse me, I'm sorry, a thorough amount of information needed to like have, especially as a teenager and an adult. So I feel like the disconnect between health advocacy is really prominent and strong, especially in the Tulsa community when we have these urban areas, but also rural cities and areas.
And adding on to that, in rural areas that might not have as many resources, translating what they do have is definitely not highest on their priority of things to get information to the students, which also furthers the disconnect between like what urban students have access to and what rural students have access to, because for the kids who can't understand just purely based off the language barrier, there's nothing to help alleviate that.
So specifically within youth substance use prevention, there's a lot of stigma surrounding having like authentic youth-centered conversations about like the risks of substance use and the reasons youth may feel the need to engage in substance use. And there's this common misconception that like talking about drugs with teens will make them more likely to want to try them. And this has been proven to not be the case. I think having more authentic youth-led conversations can lead to a lot more impactful change for youth, adults, and a lot of the systems that serve them.
That's a really good.
Yeah, I also think like looking again at the title of this talk actually is Public Health Starts with Youth. I mean, looking at youth, creating workshops, being able to provide effective health information to these people that may not have access to it. Like Nyla mentioned, people of different socioeconomic status, genders, or any sort of underlying factor that could inhibit access to healthcare in the first place is really important. And it really starts with us young people being able to educate others, whether those be older than us or younger than us, so that they're able to make change for future generations.
And even if youth don't think they're making the biggest impact or as great of an impact as other people around them are, just simply having your passion and going after it, other youth will see that and continue with you, and it motivates others as well.
I think that's our main part in Symptoms to Stories. We post like podcast episodes of real life stories and experiences to actually inspire youth to go after what they're passionate about to, but also see that their peers around them are supporting them and supporting youth-led leadership.
I really like it because I have friends that like ask me about what we're doing and what impact we've made on our community. So I think it's cool that we can educate like our friends and people in our school about what we're doing.
I think it's also really wonderful that you can share information through social media. While there is a lot of misinformation, I think it's really great to hear public health information from youth directly, especially as a teenager. I feel like there's an element of relatability and it feels more authentic and genuine when it's coming from someone your own age. So, Arin, why is it important for Nyla, why is it important for youth to advocate for public health?
So I think it's important for youth especially to advocate for public health because I feel like first, youth leadership is extremely important because we are the future leaders of this world. And so it's really important that we gain the needed leadership and responsibility, like skills and traits, to help us become as successful as possible. But not only that, just as a peer and as a teenager myself, I feel like it's better to internalize information from someone my own age that I can relate to than just hearing it on a TV by some other adult. I feel like that level of relatability, but also just understanding, is increased when you're talking to a peer in someone in your own age category. So I feel like that's why it's extremely important.
I 100% agree with you, Nyla. I think that whenever you're receiving information from someone that you connect with, you value, and you really have a true friendship with, you're more likely to be receptive to the information that they provide to you. And I think also with the added benefit of social media, especially with our youth generation, being the people that kind of are on social media more than other generations, I feel like we can use social media as a platform to kickstart this lasting change, to be able to spread this information in a way that is more accessible to other people, because as we already know, social media is very prevalent among our youth currently.
So you make a really good point, and I kind of want to hear your guys' reactions on this. You mentioned social media, and I know right now it's a really big issue, but just like media, like mistrust and misrepresentation in the media, and just like misinformation, especially when we're talking about public health. Like, can you guys talk about how you think it really affects public health information to urban and rural areas? Oh, anyone can. Hannah, do you want to start?
I think this is a little bit off topic about what you said, but I do think we should use social media as like a benefit and not see it as something negative, because I think it can be used to spread really good information, and especially since youth are constantly on social media, it can like increase community engagement because we're like sharing videos and like talking with friends about it. So I think it can help you connect more to your peers.
Do you think that like the issue of misinformation is still plaguing like social media sites?
I do think, yeah, I have seen like a lot of misinformation, but that's why I think it's good that as youth, I think we should spread good information to help get it out there.
And although there is misinformation, I do think, at least if I see a post about something, then that makes me want to go look it up for myself. So adding another like check to see if that information is true, at least the social media post or information will like inspire you to go look for yourself.
Yeah, absolutely. And I think there's like blind spots that we may not like notice, like issues that affect you, but you might not have thought about in your day-to-day life. Like I think social media can shed a lot of light on some of these under-addressed issues.
And Nyla, you talk about misinformation. I also agree with you on that. But I would also want to say that misinformation isn't a problem of the platform itself. It's a problem of the people that use it. So if youth are able to be to spread information that is factual and be able to like have a greater scope or reach, they're able to inform more people. So at the end of the day, it depends on the people that are using the platform rather than the platform itself.
So Kaytlin, how can stories contextualize the narrative behind public health statistics?
Yeah, so I like the social media stuff. There is a lot of public health statistics out there, and a lot of people don't really know the stories that come behind them. They just see the number itself. And when you only see a statistic or a number by itself, you're unable to really internalize with what's actually happening. But then once a story is there to back it up, you are able to have empathy for the person, which is kind of why we decided to name our organization Symptoms to Stories, because we wanted to shed light on some of these stories. So there's lots of statistics about people not being able to understand their healthcare provider or having a barrier. But whenever I went to go interview Maricela at St. Francis, and I actually heard the story about her and her friend with breast cancer, then I was really able to have empathy for her and her friend, who both just having the translation really like cleared up the confusion, and I was able to understand that for myself instead of just seeing a number.
You make a really good point, and I can think of like two main examples. Well, first is just like in general falling into my niche of like sexual assault awareness. We see so many statistics over it, but when we actually hear the horrifying stories, we tend to feel more like empathy and pathos towards those individuals. So I feel like it helps spread awareness more. But also that I feel like the most mainstream one is falling kind of under Arin's niche of mental health, of the USC Ice Bucket Challenge, where we would just see, like, most would just see statistics over mental health and scroll past it. But with the USC Ice Bucket Challenge, many would be like raising awareness to mental health issues and disorders, and then created a trend to make it so widespread that everyone was educated over mental health.
Can you explain a little bit about what the Ice Bucket Challenge was, Nyla?
Yeah, so it's basically just a TikTok trend where many individuals would first talk about why they're throwing a bucket of ice water on their head. And they would mainly talk about just mental health issues and give stories of their own of how mental health either negatively impacted them or a friend or a family member. And then they would also nominate 3 other people to share their stories, which would really actually help social media in general by showcasing that like the youth are not alone and that many are also struggling with mental health disorders, and just raising awareness and education over the issue. It's a really good trend.
To go on what you said, I think that really brought the community together because I also did it because I got nominated. And when you nominate more people, you're like building friendships with others. And I think if we do more activities like this, it will really like increase community engagement, and it can like help spread information we want out there.
So, Nyla, what role do peers play in challenging health behaviors among youth?
Actually,
Okay.
I'll take this question. Kind of going back to what you said, how social media is like a platform where you can spread a lot of information. I'm really thinking about, whenever we're asked this question, how things are being changed. And whenever you're thinking about how things are being changed, you're asking yourself, what sparked this change? And I think for a lot of people, especially youth, it's a person that is receptive. It's a person that really talks to you about the change that they want to make. And I feel like whenever it's someone that you can connect with, someone that you value, you're more likely to be receptive to the change that they advise you to have. And I think also with social media, like you said, being able to spread information, spread these positive health behaviors can actually lead to a change within youth among our population.
And just like us as a group, we were last year we were just all peers with our own like niches we were passionate about. And once Harini talked to one of us, and that's when our group formed, and we wanted to, create this change together. But it started just because we were peers talking about what we were passionate about.
I do agree with Arin. Like, you're more likely to listen to your friends than you're like maybe like your teachers or parents. Because speaking from personal like experience, if my parents were to tell me to do something, I probably wouldn't listen. But if my friends told me, I would go based on what they said.
Yeah, just again, like making that point over social media, I feel like social media almost has this negative stigma around it, that it's only a place where you get a lower self-esteem, and just a lower confidence. But I feel like when used in a good way and used right, I feel like it can actually spread a lot of education and actually empower many people to chase their dreams and goals. And I just feel like, especially in youth today, which it's utilized so much, someone said, I think we're like the generation that utilizes social media the most. I think it's important that we acknowledge how social media can be used and will be used for good.
Yeah, and that's kind of why we decided to do our Instagram page. And then we actually we started posting reels because we figured like that would be a better way to engage with people that are our own age, because that's a platform and way that they really like to engage with Instagram.
Yeah, I think also talking to peers about like some of these public health issues can really destigmatize some of these topics. For example, Nyla, would you like to like discuss a little bit more about like period poverty and like menstrual equity?
Yeah, so whenever I say the like term reproductive health, I feel like many are uncomfortable about the topic, and that there's almost a stigma behind it, that it's like disgusting and gross and shouldn't be talked about. But I feel like especially just sex education, period poverty, the pink tax in general, it's really plaguing the Tulsa community because of the disconnect and how many people can't afford these essential menstrual products. And therefore, just speaking about it, whether that be on social media or just in interviews and podcasts like these, it really destigmatizes the whole nature of reproductive health.
So kind of going back to like the Instagram page that we have, something we do is we spread like a lot of information on there, like creating infographics. But I think a good idea maybe would be, we did make one reel, which is what you said, but to connect with youth more, I think maybe doing stuff more like that can connect to them with what we were talking about. If we connect with our peers, we can spread information more clearly. So I just think that's a good idea.
I think that's great. Is there anything you want to add about how certain social determinants of health can affect youth health outcomes, Hannah?
I think so. A lot of people that don't have like houses, like when the weather hits hard, it really affects them because they have like nowhere to go, and especially in the winter, there's a lot of death rates because there's nothing they can do about it because homeless shelters fill up fast. So I just feel like weather really impacts homeless people.
Harini, did you have an opinion on the question about social determinants of health that affect youth health outcomes?
Yeah, absolutely. So I feel like there's a lot of factors that affect whether or not youth use substances. One of the biggest ones that I've actually personally researched is called adverse childhood experiences, or ACEs, and it's a set of 10 different factors surrounding whether you've experienced interpersonal violence, whether one of your parents was incarcerated, if you've experienced sexual abuse. There's a variety of different questions that address like if you've experienced certain types of adversity, and it gives you a score from 1 to 10. And even just experiencing one of these adverse childhood experiences can negatively impact a lot of different health outcomes. One of those being your likelihood of using substances at any point throughout your lifetime, but particularly in your adolescence, because this can really impact your health outcomes during that time. So that's one social determinant of health that I've seen that can affect youth health outcomes, but there's a lot more as well. One of those could be that access to healthy and nutritious food could impact your relationship with food throughout your lifetime, whether that be like how you associate like sugary foods and sugary drinks, like what you perceive as healthy and what you have access to and what you can afford. And all of that really depends on what you have near you. If you live in a town that's surrounded by a lot of fast food restaurants and that's what you grew up around, your perception of what is healthy and nutritious is going to look a lot different than somebody who grew up eating organic food throughout their life.
I like that. That's a really good point. And I would like to touch on what you said specifically when it's like it's the environment you grow up in. It's the environment really shapes the outcome. So like especially I'm sure it falls into all of our niches, but especially in reproductive health, like there are some rural areas where there are only like one gas station, and therefore you can only get these menstrual products at only one place, therefore creating that barrier to getting essential products. And I think in general, I feel like that is one of the biggest determinants of your outcomes, and I really like that. That was a really good point.
I want to add on to what both of you guys said, specifically within my respective niche in mental health. I think that social connectivity, especially like the connections that you make, play a big role in how mentally stable you are, like your health mentally. And I think that whenever you have isolation and you feel distant from other people, it can lead to the development of mental health conditions, which in turn affect your health, obviously. But especially like Harini mentioned, in the adolescent stage, I actually did a TED Talk at my school over mental health and adolescence, and I found in the research I conducted at my school that in the adolescent stage, mental health effects of certain disorders are the most prevalent. So being able to talk about these, being able to spread information, and being able to connect more really helps us stay more healthy as a population and helps us develop at a better rate.
Yeah, and I think also the disconnect that people could feel in like a rural area could also kind of prevent them from wanting to go and seek help because they don't feel connections with anyone. So I feel like having social connections or really emphasizing that is really important as like people go and seek help for themselves, hopefully get the information they need and have it to where they can understand it. And also that goes into all of our niches as well.
Absolutely. So finally, what's something that you're hopeful about for the future of youth engagement in public health?
So I'm extremely hopeful, but I think the main thing that really sparked me was whenever I interviewed for Symptoms of Stories, Miss Abigail Chow. She is a university student at the University of Tulsa, and in her high school days, she actually was one of the leaders of Red Equity Oklahoma, which basically is trying to end period poverty and really raise awareness to menstrual equity. And I interviewed her and I was like, why did you decide to do this? And she was explaining how youth voices are so important, especially in this day and age, and that she wants to inspire all youth to act in what they're passionate in. And currently right now she is a founder of a company, but also she still is raising awareness about this issue, showcasing that your passion is always going to go and be with you through your entire life. And I think that inspires me and makes me feel hopeful about our future in general.
I feel like kind of adding on to that before we get to other questions. I wanted to talk about within the scope of our very own project. It was under the Carnegie Youth Leaders Grant that we had received from kind of like a project that we had all collectively like participated in. But it's not just us that are trying to make changes. There's also 100 other groups all around the world that have analyzed the world and found that there are problems that need to be solved. So it's not just us as youth taking steps, it's other people all around the world that are also taking the collective action to make change within their community. So I feel like whenever we look towards the light, we see that it's not just us, but also everyone else that are trying to make positive changes.
I think we're going to move on to audience questions next.
Hello, my name's Richard. Could any of you explain the pink tax for me?
Oh yeah, so the pink tax is just basically a tax put specifically on menstrual products to obviously to create that disconnect, and therefore many women, especially in these underserved areas, can't afford these essential menstrual products simply because of the pink tax that are put onto it.
Okay. What type of increase are we seeing with that pink tax? Do you have that information?
It kind of varies per area and per zip code.
Hi, my name is Milton. I heard the conversation about food. I'm just wondering, how is school food for you guys? Do you feel like you have healthy options?
I think our school makes an effort to have healthier options. I know like all of the food in our vending machines are all reduced fat, those types of foods. But I think for like someone else can touch on like the lunch food though.
So in general, I feel like what I've seen on a lunch plate, there's obviously your main course, then there's a fruit, a veggie, and some kind of dessert. And so they're trying to make it as balanced as possible, but obviously it depends per school simply because of the amount of funding and just like the disconnect versus like public and private schools. Touching on like Kaytlin when she says vending machines, I feel like most of our vending machines, they have like sodas, they have zero sugar sodas, but they also just have chips, reduced fat chips, and also candy. So I feel like it has a variety, and it's kind of your choice whether you want to make it a healthy meal or not.
Going back to what Nyla said about like what school you go to, I feel like Jinx is very fortunate. We have a lot of funding for our school lunches, so we have so many options. We have like different types of food, like Asian food, American food, Mexican food. Like you can choose what you want, and I'm very fortunate that we have.
So we had a question come up online about the topic of empathy, and in working with the different communities that you all are working in, what is the role of empathy? How can you, in your work, maybe advocate, like help people advocate for more empathy? Because like I know, for example, like when I, go to the doctor, sometimes I feel like they're just not listening to me, or they just not understanding what I'm saying. And so, can you kind of talk about the role of like how important it is to build up that empathy, and how like maybe ways to encourage young people to be to say like, I need you to understand me and hear me, like, and be more empathetic?
Can answer. So I do think empathy is what drives me to continue to advocate for what I'm passionate about, just because I've heard the stories from the people I've interviewed. And I think actually sharing those stories and hearing those stories is a big driver of the empathy that I feel. So that's kind of our mission within our organization, is to get the stories out to more youth. And through our podcast and our Instagram, we really just hope to share the stories of other people's experiences and try and have those youth experience the empathy that we felt when we first heard them.
Yeah, and especially when you're interviewing others, when they're sharing their story, you want to know that it's you want them to know it's a safe place, that they can share the hard times that they've been through. And so I feel like creating a really respectful but also empathetic environment is really imperative to get the correct information from the people we interview.
Yeah, absolutely. I feel like it's important to cultivate a brave space where people feel comfortable sharing a lot of these stories and vulnerable experiences.
I mean, it sounds really cliche once again, but really what everyone's been saying is put yourself in someone else's shoes. And I really think people kind of listen to this and they're like, oh yeah, we'll do it, but they never really take it to heart. And I think that throughout our program specifically, we're able to create this empathetic environment, this academic and respected environment as well, to make sure that it is okay to be able to share stories that may feel a little bit emotional, or may kind of be hard for others to share, and just being able to be empathetic about it, being able to make sure that they feel safe and they feel okay with sharing their story is really, really important.
To add on to what Arin said, because we have this empathy, this is how we're connecting with youth in our community. And like, this is how we're getting information out, because they'll really listen to us because we can connect with them.
We have time for one more question.
You talked earlier about kind of that stereotype of, I think Harini, you said screenager, right? Of like, teens really, or youth really not being interested in, the sort of like hard science field of the medical field. Are you finding, as you are working with more youth and going out in the community, that there are more young people interested in going into like physical health, mental health, and these different public health fields? Because I think we as adults don't really think that like there's a whole lot of interest, but maybe we're wrong, right?
I feel like as youth learn about like different career paths and get to explore a lot of these opportunities, you never know what you're interested in until you like learn about it or try something out. And I feel like having more exposure to some of these opportunities could lead to more interest. And I think that's one of the reasons we might not see as much interest at the beginning, but as youth grow up, they might like get more exposure to some of these opportunities.
When you actually bring up stereotypes, so I'm like I like to be a people pleaser, and so whenever I hear these stereotypes, it really hurts me inside to know that somebody else is getting bullied or being taunted for something that they really can't control. And it's really this thing that really like lights the spark in me to make a change. And I hope that other youth can see this as well and be like, we can't allow this to continue in our world, and we need to make a change about it. So going into mental health, going into reproductive health, going into homelessness, going into all of our respective niches are all important to ensure that we can have a really more connected community.
And just touching on that, I feel like the medical field is so attractive to so many because of the impact you can make. Like us as youth, I feel like the main thing we want to do is make a change in our world. And by listening to these stories, the medical field is just illustrated at this as this safe place where we we can make an impact, but also help others. So I feel like that's why many want to go in the medical field in the first place, to leave their mark in the world.
Absolutely. Thank you so much for a great conversation. I want to thank our panelists for joining us today in this very important conversation and extend our appreciation to the organizations that make Teen Talk possible, Tri-City Collective and Central High School. Thank you to everyone who joined us live and in person. Please like and follow and be sure to join us again next month.